Good morning again. I'm Dr. Sanjay Pandey from the Kokilaben Ambani Hospital in the Department of Urology at the Andheri West. It's nice to come back to you again on this very important aspect of progressive changes happening in men's health. Men very gracefully age from their 40s to 50s and into 60s and 70s. This progressive change, which happens to them, can actually bring about some changes which is invisible. So what is invisible does matter to us. And therefore, as a urologist, looking at men's health, looking at young men and in their mature years of life, it is important for me to come back to you and tell you that when you gracefully age from 40s to 50s and 50s to 60s, the changes are sometimes very subtle. Changes which happen can bring about progression of aspects in urinary health. So when I look at urinary health of men, I understand that men have got a flow in which they can paint on the wall. So when I was younger, I could pass my urine with a great speed. The speed was such that I could paint on the wall. I could scribble on the wall with that speed and trajectory. Now that is gradually changing. From 40s to 50s, as there is huge amount of progression and changes happening in the hormone status, the prostate, an organ which undergoes a change, is probably not known to mankind. It's not known to the society in general. So men who are in their 40s, men who are in their 50s, and then gracefully into 60s and 70s will find a change, which is about progression of obstruction to the flow of urine. What does it mean? The flow of urine gradually goes down. From what we could paint on the wall, gradually the flow is gradually going down. It's going down to a limit where the flow falls closer to your body and then probably falls on your shoes. Maybe later on in that age group, which is fathers and grandfathers, the urine could be dribbling. It may not be emptying completely. You have to strain to pass urine out. You have to push urine out. In a public toilet, when you come out of an aircraft and you go to the washroom, people complete urination while you're still struggling to start or struggling to finish. And when you finish, the bladder is still not empty. So, in other words, are you in your 40s, 50s, 60s, and 70s? Number one, are you having difficulty in emptying your bladder completely? Are you not emptying your bladder fully? Is there a change happening which you can now make out compared to yourself or compared to your peers that the urinary flow is lesser and lesser with passing time? That means the thin caliber of stream, the stream which is not so forceful as it was in the past, the force that it would actually give you a comfort around is missing. At the end of it, you leave the toilet and the bladder is still not empty. If these are your pictures of urinary flow, which you do anything between 5, 8, 10 times a day, and maybe once or twice at night, it's time to wake up. So men in their 40s, 50s, 60s, and 70s who have got a progressive urinary flow changes need not sit home and wait for a health checkup to give them an idea that the prostate is enlarging. The prostate is a male gland. It cannot be visualized by you and me. It is just below the urinary bladder. Urinary bladder is an organ which is silently listening to you and letting the bladder fill up because it's like a bag. It is down there in the pelvis, down there exactly. When the bladder fills up, you feel like passing urine. That's the time you go and open the zip, and then the bladder contracts. Until that time, the bladder is gradually filling up. So bladder is a pretty predictable organ. It listens to you. You are the master. Bladder is a slave. It agrees to fill up till a point in time when you are socially continent and capable enough to be able to reach a washroom, open the zip, and then the bladder decides to contract by the internal signaling pathways, which it has been doing for the last 20, 40 years. And now when the bladder contracts, the urine comes out through the passage, which is controlled by the prostate. So prostate, a male gland, which is approximately 10, 15 grams in your younger days, gradually and progressively enlarges in size. And that enlargement is related to the hormone changes happening progressively in men. Don't forget, men don't have menstrual periods. Men have never know what is their hormone change happening around. And progressively, as the hormone changes around, we finally find weak, we find erectile dysfunction, we find sexually low, we find the attraction going down. We also find that the prostate, which is governed by the male hormone testosterone, that internally converts to dihydrotestosterone, a metabolite of which actually brings about a change in the prostate that for a common man on the street could be an enlargement of the prostate, which is what you're worried about, is something which can bring about an occlusion to the urinary passage. So if I show you this and make you understand that this is the prostate and this is the urinary passage through which you pass urine, this prostate is undergoing a change. And this change can occlude the urinary passage and that black line of the urinary passage, which already God gave narrow, which you can identify at the tip of your urination. passage will gradually slow down. So if you are in your 40s, 50s, 60s, if your flow is not good, who is suffering? You suffer silently, but you adjust to it. You have a compensatory mechanism and you compensate thoroughly well. You compensate so well that you're able to pass urine out, you're able to push urine out. In health checkups, or if there are any punctuation marks in health, you undergo some ultrasound, which gives you an idea about the change in size of prostate, which sometimes can bother you. But who is suffering all the suffering is by the urinary bladder. The bladder has to actually contract and push urine out in the background of an obstruction which is developing. So an obstruction developing down there, the bladder has to push, push, push. What is happening? A progressive change which happens millimeter by millimeter, hour by hour, day by day, month by month, year by year, and decade by decade is a very slow process. And this process will not stop. So for all men who have got urinary complaints of obstruction to the flow of urine, who find their stream getting narrowed, who find that their bladder is not able to empty even after complete pushing around, you actually are not pushing through your bladder, but you may pushing through your tummy, which actually pushes the bladder out. Like sometimes in constipation, we are sitting there and the motion is not coming and the stools are hard and you push your stools out. A very practical thought. Similarly, many a times there's bladder which is contracting erratically to an obstruction that is developing at the level of prostate through which the urinary passage goes. The bladder contracts more and more and more to outcome the resistance which is actually progressing, increasing at the level of the prostate. So prostate is an organ, which is a hormone related organ. Through the prostate, the urinary passage goes like you go through the door. If the door closes down, you really can't go out. So the entire aspect of you visualizing is you're sitting in the room in front of me in my clinic at the Kokilaben hospital in the department of urology on the second floor. When the consult is done, I will ask you to go. You walk and the door opens. First, you have to walk and then the door opens and then you reach outside. Similarly, the bladder has to contract first. In a social atmosphere where you are good enough to empty your urine, you open the zip, the bladder contracts, the passage opens and urine comes out. So there's an understanding between the bladder and the prostate, the prostatic urethra. Bladder contracts, passage open, urine comes out. You walk, door opens and you reach outside. So nothing very big rocket science about it. But yes, there's a progression and change happening around, which is related to the hormone changes. The prostate is undergoing a change. The change could be an enlargement of the prostate or could be a very small prostate. A small or a large prostate does not matter to a urologist. What matters is how is your urinary health? How good is your urinary flow? Is the flow gradually going down? And somebody may complain, my flow has gradually gone down over the last few months. My flow is very poor over the last few years, and I'm just not able to pass urine. I'm passing drop. So for those men who gradually are progressing in their urinary flow over months and are finding a difficult situation, what do? They either see a urologist, they see a general practitioner, they see their family physician, but the entire aspect internally is changing. And the bladder is continuing to suffer because it has to contract and push, push, push. I close the door and go home. You would continue knocking, knocking, knocking. So you are busy suffering in terms of knocking. So the bladder is busy knocking in the background of a changing age. And why am I telling you this in 40s, 50s, 60s? Because in 70s and 80s, it's too late. The bladder has already suffered for decades. So the project today is save the bladder. How do you save the bladder? By identifying yourself that my urinary flow is not good. So you would complain that my flow has gone down over months and I've been able to compensate. I'm okay, doctor. I'm not very worried about it. I saw my family physician and there's nothing very significant looking like. The test that you did was called ultrasonography. Ultrasonography is a wonderful test. It's a screening test which actually can be looked up by a colleague ultrasonologist or a radiologist who looks at your bladder and identifies that the bladder is getting thickened because it's contracting erratically against an obstruction. The bladder does not empty completely. The bladder gets trabeculated. Its lining becomes a little mushy. The prostate is enlarging is what a sonologist tells. The enlargement of prostate is going to happen. Your age will gradually change. Nobody will stay 40 and 50. You will turn 60 and 70 and wish you turn 80 and 90 and 100 too. In other words, the progression which happens to all of us. So the prostate may enlarge, which is measured by the sonologist. Enlargement of prostate does not anyway thrill a urologist. What thrills him is, are you safe? Are you comfortable? Are you good in your health, in urinary health, which is never discussed, and which is sometimes a shame, and people don't discuss it. So friends, it is important for us to wake up to this phenomena that our urinary health is changing. Our prostate may enlarge and become big as measured on the sonography year after year, or the prostate may occlude the urinary passage even if it's small. And our intention is to assess how much is the obstruction to the flow of urine. What does it mean? If you want to assess your heart, what do? You only do an ECG and you get to know your heart is all good. We never open the heart. If I want to understand the understanding between the bladder and the prostate, which is progressively changing from my school, college days towards my mature years and towards my elderly age around, all I will do is a test called uroflowmetry. Metry is measurement, flow is speed. I call it as ECG of the bladder. That means like an ECG graph which comes PQRS complex and tells your heart is good, please go home. Similarly, when you do a uroflowmetry, that means you come over and at the Kokilaben hospital in the department of urology, when your bladder is good full and you pass urine in a computerized toilet, the graph which comes out ideally is a bell-shaped curve. We then check the residual volume and get to know the reality of your performance. To me, a uroflowmetry, which I term as an ECG of the bladder, is actually a report card. How good you are, how good a student you are, is only known best when you go to the examination hall and perform. Similarly, when you go to the examination hall, call the uroflowmetry room and pass urine there, we got to know all about you. How good is your flow? Is it passing well? Is the urine flowing the way it has to by the coordination between the bladder contracting and the passage opening, which is what was gifted to you by a normal anatomy, which is progressively changing because of hormone changes. Sadly, this is not in public domain. People miss out because we as young men are capable enough to drive this compensation by the bladder contracting more and we learning it. But if you close your eyes and look at it, your name is the same, your photograph changes every year. The black hairs will turn gray. You cannot escape it. So changes will happen. And these changes need to be picked up. These changes can be picked up only by an awareness drive at a platform like this, your channel, where I continue to speak intermittently and wake you up. Because urinary flow will progressively flow and go down for everybody. No man will escape it. Somebody may pick up early and would see a urologist in various cities and towns where a doctor would assess you by a symptom score called the ipss symptom score, which you can download from the internet and assess yourself, score yourself. ipss, number one. Number two, you would be asked questions which would give an idea, and the score is mild, moderate, or severe. We know how much it has progressed or how much your body has adjusted to progressive change. And then we look at the bigger aspect. The aspect is a uroflowmetry or your performance which you adjusted to. So your performance tells us all. How good a student you are is only known by a report card, not by your looks or by your capability, other than the performance. And the performance is best done not in your toilet and in your washroom, but a washroom where you go and give an exam, like the examination hall. So friends, as we gracefully age, the progression is something which we cannot halt. We need to know, as Helen Keller said, it is important for us to be able to dial U for urology or to be able to take that negotiating curve of a sharp bend which is happening in our health in 40s, 50s. On one side, the erectile function is progressively changing. We are incapable, good enough to what we were in the past in the bed, we are not enough. We are also incapable in the washroom where our aiming is getting pure. We can't aim into the washroom. We dribble, we pass urine, something, we probably don't empty anything and everything. And this is something which we need to wake up to. So this entire short conversation with you as a monologue was to wake you up. Men will grow, men will change, prostate will grow or prostate may be small. But a doctor as a urologist in this country would be interested in your flow pattern. Would be looking at what is the urinary flow. On ultrasonography, we don't know what you did in the washroom. We knew that you had a bladder full, you went to the washroom, emptied your bladder, and we can only know the residual volume, which can even be minimal and your flow may be poor, or which can be very high as a very baseline raw investigation giving an idea that you don't empty your bladder well. So friends, there are many patients across the country, or there are many respected individuals in their 40s, 50s, and 60s who are taking medicines. Medicines for improving their flow, medicines for attempting to shrink the prostate gland and are not having an effect. एक दिन दवाई बंद की, पेशाब बंद हो जाता है. You stop the medicine for a day, you miss out medicine for a week, and the urinary flow is poor, which means that you are living on the advantage of the medication keeping you afloat every day. Therefore, why live on the medicines if you're not improving? The entire attempt by a urologist or your family physician is to give you the right medication after assessment that your urinary flow should stay good. That means your flow should be as good as you wanted, as was in the young age. If it is not, the changes are significant, they are dramatic and need to be assessed as to why. If you're not going out of the room, then there are only two reasons. Either you are too weak and not getting up, or the bladder, unfortunately, or the bladder neck is too closed. Either the bladder is not contracting or the passage is too tight. If you're not going out, either you are too weak or not getting up, or this door is too closed and you really can't push it out. And therefore, the bladder which is continuing to suffer is something which is not visible to all of us. We can only pick it up on a very indirect test called the ultrasound, which gives the bladder wall is thickened. The bladder does not empty completely, though it works for you non-stop morning till midnight, fills up, contracts, fills up and contracts, but is not able to empty because it's overworking. And the overwork sometimes can give you a frequency, urgency, and urge incontinence. Some people present late. They come and say, we are passing urine very frequently. We can't control urine and we don't pass urine very well. So we were never passing urine very well in the past too. But what is happening now is that this bladder is actually contracting and making you run more frequently. It is on its last leg. It is trying to push urine out and we can't empty urine. So friends, this entire aspect of understanding changes in the prostate health is only to identify that the prostate will undergo a change, a hormone related change, through which an occlusion to the urinary passage will not be easy to decipher. The only way in 40s, 50s is to pick up that our fathers and grandfathers have gone through prostate surgery. That means they underwent a surgery where you used to cut and remove the prostate internally for the passage to get clear. Today, in the era where we are trying to save the bladder from excessive contraction, which is happening in the background of an obstruction, we have got minimally invasive surgical treatments for prostate to save the bladder, to get your tomorrows better than what they are today's. And for that, obviously, we do minimally invasive surgical therapy where we actually open the prostate. An opening of the prostate today is being done by urolift, prostate urethral lift, something which actually, by those implanted clips, takes the prostate away from the urethra and keeps the passage as open as you want to. The urinary flow gets better. A minimally invasive surgical therapy where you don't have to cut, where you don't have to have any erectile or ejaculatory dysfunction, where you don't have to bleed, where the risk of strictures and incontinence is almost nil. You are much safer. And therefore, when you wake up to this tomorrow's, you know that the changes will happen. Is it not time for a man in 40s, 50s, or 60s who is complaining of urinary flow? It could be a doctor, it could be an engineer, it could be a banker, it could be a pilot, it could be a marine engineer, it could be a politician, it could be a lawyer. Everybody is busy in his lifetime, stitching and probably connecting the dots between him, his family, his workplace. He probably misses out a lot of things around. And the urinary health is something which probably will not be static for any man. On one side, sexually it goes down where we look at andrology, something which I do 24/7, all days of the week, looking at erectile function of young men gradually going down, people developing Peyronie's disease or bend in the penis, erections completely going down and they're not capable enough. And this progresses with age. Similarly, urinary flow progresses with age. And is it a time for us to wake up? So you in your 40s, 50s, 60s, having a poor flow, not responding to medicines and taking medicines for a long time and still not have improved, perhaps not been tested. You need to do a uroflowmetry to identify how good is your report card. How good are you for your tomorrows, which could only be geriatric or elderly age group. In this, some people may progress towards cancer prostate, and that we treat now early prostate cancer by robotic radical prostatectomy, which is something we continue doing few times a week at the Kokilaben hospital by myself. I think it's time to wake up for your prostate health, for better tomorrows, for saving the bladder and not having an issue where you land up with a situation from where you're passing urine in drops, where you're passing drop, where the urine is completely blocked, you need a catheter, and all this is progressed. And therefore, many in their 70s, 80s do continue to suffer because they were taking medicines very blindly in the younger age group. Medicines were given by somebody without an assessment or without a continued follow-up and assessment. So don't miss out. In your 50s, 60s, you need to know a urologist in your city and country. It is important for you to understand that urinary health is on a progression and change beyond a point in time. It accelerates into changes around which we suddenly don't believe. And those things can actually matter around. So let's wake up to projects of identifying ourselves, identifying our urinary and sexual health as young men in 40s, 50s, and 60s, identifying that we should save the bladder as a project, not letting bladder unable to completely contract and push out after decades of obstruction, not us pushing our bladder through the tummy that we push around sometimes in constipation. And if required, the urologist decides as to what therapy is best for you, a medical management assessment or a minimally invasive surgical treatment where we place those clips and do a prostate urethral lift. From where onward, patients are doing very well. It's a surgery without a surgery. That means we don't operate, cut, but we take a telescope, assess, evaluate, and remove the prostate away from the midline, clip it off, change the natural history of its continued obstruction to the flow. So there's lots waiting to happen when you and I wake up and probably take it forward to the next level. Thank you so much.